So how has your body changed from before baby to after pregnancy and birth? Well, there's some really obvious ones. Your tummy will have stretched, and it will have stretched this way, and it will have stretched that way. If you've had a C-section, there's a good chance you've got some scar tissue going on down here, and that's not just superficial, that's deep down. So we need to think about that. It might take a while for that to stop feeling numb and kind of tingly, and it might take a while for us to really consider how we adapt things just to make things more comfortable for you. If you've had a vaginal delivery, a natural one without any intervention, there'll have obviously been considerable amounts of stretching in that area, which you don't need to be reminded of. So we want to think about, really kind of making sure that's kind of watertight and fit for purpose. If you've had some kind of intervention, ventouse, forceps, then that may have been more considerable stretching, and that might cause a little bit of discomfort down below. So we do need to consider the obvious things that will have changed. Less obvious perhaps, hips. So during pregnancy, and this tends to be more obvious post second births, or if you have more than that, then subsequent. So your pelvis tilts this way. So naturally, this is our kind of neutral position, and then the pelvic tends to tilt that way. What that can do is cause this kind of tightness around the lower back, but also in the hips. Add to that the fact that we'll be quite deconditioned, the bottom, inner thighs, tummy muscles, and generally in that last kind of 6 weeks of pregnancy, first 6 weeks postnatal, you'll have been more sedentary than you normally are, even if you're a super active person. So you've lost muscle tone in the thighs, in the bottom, in the tummy. That's going to add strain to things like pelvic floor and lower back, things that are really kind of struggling to keep you upright in your new different lifestyle. So you'll be picking things up more often, doing things differently. What we want to make sure, therefore, in a Pilates class is that we don't go straight into all this kind of stuff here, there, because we can just find that the hips take all of the strain. So there are a few subtle differences as well as the ones that you're more probably aware of, which are the ones like kind of watching out for doing too many crunches and all that kind of stuff. So I'm going to talk specifically today about how we might modify mainstream Pilates exercises to make them more comfortable for you.